are live, Senators.
All right, perfect. Again, good morning. This continuation, February 23 of Senate Health and Welfare Committee. It's 10:45. We're going to continue with our program review of S18, an act related to the banning of flavored tobacco products and e-liquids. Our first speaker up is Dr. Gogo. We have approximately 12-13 minutes per testimony. We would like all the speakers, if they could, to respect their time frames. If we get grossly outside the boundaries, we'll give you a nod. But Dr. Gogo, if you would say your name for the record, and the floor is yours.
Thank you. My name is Prospero Gogo. I'm an interventional cardiologist at UVM, and I've been in Vermont for 25 years. I'm committed to the health of all Vermonters. My job today is to give you a perspective on the unfortunate effects of smoking on the Vermont population, at least a small snippet of the costs involved, as well as the potential pitfalls of allowing the current vaping epidemic to continue amongst our youth. I will give you some slides, and if Witchy, if you could give me a privilege to share my screen.
Yes, one moment. You should be good now.
Thank you. Let me see here. Okay, here we go. So anyway, I just want to talk briefly about some data regarding the present, the future, and the past. All right. So those of you, this is a similar talk that I gave to the committee in 2021, but I did update it with some data. So this is the past, and this is actually showing really good results in our public health initiative to reduce the amount of smokers in the United States. You can see all through the categories: American males in the blue, American females in the pink, American youth aged 12 to 17 in the yellow, and American high school students in green. Smoking rates all the way up through the mid-teens were decreasing substantially and remain that low for cigarette smoking, although there's some plateauing of these rates. And here's the present. All right, so unfortunately, there's a substantial increase in the use of electronic cigarettes amongst the U.S. population. And this data goes from the New England Journal of Medicine all the way up through 2019. The red is the electronic cigarettes. If you look at our data here in Vermont, this is actually smokers amongst all cath lab procedures at UVMMC in the last fiscal year of UVM. 21% of all people getting a cath procedure of some kind are current smokers, and that's a little bit higher than the population. 983 stent procedures per year here at Vermont UVM, and a substantial number of these patients are smokers currently. 235 large heart attacks. These are called STEMIs. We treated last year at UVMMC. This does not include the Dartmouth-Hitchcock volume as well, with a substantial number of Vermonters on the east side of the state going to Dartmouth for their care. But the thing about these large heart attacks is smoking makes coronary artery disease pretty unstable. And so almost half of the patients who come in for a large heart attack at UVM and nationwide in all the international trials and registries are current smokers. This is what it costs. So if you look at the DRG for Medicare reimbursement for patients who come in with a heart attack and get a stent, and this is the standard of care for these patients, it's $18,000 Medicare reimbursement per patient. If you look at that, there's 650 Vermonters who are Medicare eligible, estimated at UVMMC and Dartmouth each year. So the cost just to Medicare reimbursement is almost $12 million a year. This does not include private insurance, which reimburses at a substantially higher rate than Medicare for the same DRG. So we're probably missing another doubling of this, close to $10 million in private insurance each year, and just for the one diagnosis of heart attack with stents. But it's not just heart attack that's caused by smoking. You can see here that within the cardiovascular realm, there's a lot of other diagnoses that are associated with smoking, like atrial fibrillation, cardiogenic shock, and congestive heart failure. If you look at the larger group of diseases associated with smoking, it goes all the way through cancer and bronchitis, lung disease, and bladder cancer. So there are a lot of other diseases related to smoking, and so we're only getting a small snippet of it with this data. Here's what it costs Vermonters each year. 1,000 Vermonters are estimated to die by smoking each year. This is from the American Heart Association data that Tina may have shared with you earlier. 404 million direct healthcare costs. $1,037 estimated per household, per person in Vermont, in terms of state and federal tax burden going to smoking-related diseases, and an estimated $15 million tobacco industry marketing spend in Vermont. So we're trying to fight against this marketing. That is a segue into this data, which is the potential for what's going on in the future. I shared this with the committee previously, and Juul, a pretty bad actor in terms of marketing, can see their very young, healthy people on all their pictures and a very nice color scheme. They learned their lesson, and the feds have actually taken action on Juul because of this marketing. And so this is their current web page, now just black and white, nothing too exciting. But the color schema in this presentation is related to those Juul earlier marketing colors. This is the current status even today, though. If you're not using a Juul and you have a customizable vaping product, you can actually still order flavors online that are, if you look at it, like this one, Unicorn Vomit, they're geared towards marketing with something of a youthful preponderance. And if you look at their top 10 bestsellers for both flavorwest.com and the vapemall.com, it looks like you're walking into a candy store. These are their top 10 flavor sales per at the last time I looked at this a couple of days ago, including Extreme Ice. Another important one is menthol, banana cream, choco wafer bar. So these companies are gearing, even though these are supposed to be products for adults, their marketing is actually very attractive to kids. And if you think about what we had to do with the tobacco industry marketing years ago with getting rid of Joe Camel and all the other cartoons, that had a substantial impact on the uptake of smoking amongst kids. Here's some other data. You're twice as likely to pick up combustible tobacco smoking if you're a current vapor. And that's some data, preliminary data from some of the pediatric journals. Here's something also interesting, 21 to 34%. That's the increase of vaping as a marijuana delivery device amongst 12th graders in the Monitoring the Future survey between 2016 and 2018. There was also a strong association between vaping device use and marijuana vaping, between vaping device use and marijuana use, between vaping device use and synthetic cannabinoids. So this is also spreading over into the non-tobacco trends as well. What does vaping do to your cardiovascular health? Well, there is some preliminary data looking at this. This was actually announced at the ACC Scientific Sessions a couple of years ago. If you look at non-users who don't smoke or vape, there seems to be a small signal with vaping and recurrent heart attack in patients who have been already admitted for one heart attack. Of course, if you look at smoking, it's going to be more than 120% for this relative risk, but still there is some signal that vaping may be contributing to some recurrent cardiovascular risk. Now, this is an association, not causation, and that data does not apply to kids, which is concerning because we don't have a lot of data on the cardiovascular effects of vaping on kids. But if you look at these non-outcomes data, just looking at the physiology of what vaping does to your body, there's a lot of effects of vaping primarily driven by high doses of nicotine in these products, where you get higher rates of inflammation, higher rates of changes in your lipid profile, and then also a little bit more oxidized bad cholesterol circulating in your blood. So these are all published in peer-reviewed data, peer-reviewed journals. We just don't have long-term outcomes, and that's because the only long-term outcomes we have is after the damage has been done. We're not going to randomize kids to vaping versus not vaping and see how they do over the next 15 years. That's the gold standard for how we understand the true effect of one particular factor on the health of people, but that's not possible. So the only way we knew that tobacco smoking was really bad for us was following what happened when disaster has already struck on a lot of Vermonters. There is a lot of data suggesting that this may also be the future for kids picking up electronic cigarettes and vaping. This is a slide from the American Heart Association statement, the cardiopulmonary consequences of vaping in adolescents. This was just published last year. And you can see these are the general effects of high nicotine containing vaping products on the cardiovascular system, including increased arterial stiffness, high blood pressure, increased sympathetic tone, a lot of pathophysiology that in previous studies with cigarettes predicted the presence of cardiovascular disease down the line. So we can't tell you that, yeah, if you smoke and vape, you're going to have heart disease, but there's a strong association with what's going on right now in patients and in the current users' bodies, that this may be a severe epidemic in 20 to 30 years by the time these e-vapors are middle-aged. So I'll stop there. I just wanted to give you a quick thumbnail of the data that I have and why I strongly support a flavor ban for both all flavors in tobacco products and vaping products, including menthol. And I'll stop if you guys have any questions.
Excellent. Thank you, Dr. Gogo. Excellent presentation. Thank you. I got a question. Maybe it's a general question. Is vaping cannabis allowed with the commercialization of marijuana in Vermont?
Jennifer Garvey, Legislative Council, is vaping cannabis? Yes, I believe it is. There are some limitations on flavors, and I'm trying to get some clarification from the attorney who works in that area about what they are.
Doctor, is there a possibility some ingenious young individual could figure out how to vape opioids if they could get it to the plot, into the bottle?
I am not an expert in substance abuse, so I would defer to the experts on that. Yeah, so it is, I'd say there's a lot of possibilities, but I'm not sure.
Okay, thank you. Any questions? All right, well, thank you very much, Dr. Gogo. Appreciate your testimony. And just as a matter of record, you may have briefed this before previously to the committee, but you call up all 3 new senators to the committee, so you have 100% saturation rate in today's briefing. So thank you very much.
Perfect. Okay. Oh, and just to let you know, this background is actually cath lab number 2 at UVM, so it's an artificial background, but I'm going there right now.
Thank you.
Thank you. And next up is Dr. Farisi. If I mispronounce that, please let me know. You have the floor.
Thank you. Yes, that's the correct pronunciation. Can you all hear me okay?
Yes.
Good.
Okay, great. Thank you. I'm sorry that I can't be there in person. I was really hoping to be, but I appreciate your flexibility with allowing me to come and provide my testimony via Zoom. So good morning. Thank you for the opportunity to come and speak to you all about the role of flavors in tobacco products, including e-cigarettes, and their effects on child health. So my name is Dr. Ellie Farisi. I am a practicing pediatrician at the University of Vermont Children's Hospital, and I specialize in caring for children with lung and breathing problems. And I'm here to speak on behalf of the Vermont Medical Society and the state chapter of the American Academy of Pediatrics in support of legislation that eliminates flavors in tobacco products and e-liquids, including mint and menthol. So Vermont pediatricians are increasingly concerned about the high rates of vaping that we're seeing in youth, and young people tell us that they start in part because the flavors make these products appealing and they make it seem really benign to them. But then they find themselves addicted and they can't stop using these products even when they want to. So I have one 18-year-old patient I saw recently who started vaping at the age of 13 and told me, quote, "I didn't know what I was doing. Another kid passed me something and told me it tasted like fruit punch, and that sounded good to me. It made me feel really good. I didn't know it had nicotine in it. I just knew that I wanted to do it again," close quote. So this young person has made 2 serious attempts to quit in the last year and has not been able to tolerate the types of emotional swings that come from nicotine withdrawal. And they told me, quote, "I feel like I've lost a lot of control over my life because I can't do anything without having a vape on me." So this is someone who uses a flavored nicotine-containing vape every morning within 5 minutes of waking up, vapes throughout the day, and then it's the last thing that they do before they go to bed at night. And this person also has months of coughing every time that they get sick with a cold, and ongoing chest pain that worsens every time they vape, and they haven't been able to quit even though it makes them feel sick and they want to quit. And so I want this committee to know that these are the types of stories that pediatricians across the state are seeing in clinical practice over the last several years with respect to nicotine addiction in youth. I have the opportunity to visit about 12 primary care practices throughout the state, all the way from Brattleboro up to Newport, and worked where I can to connect these practices with their schools and substance use professionals in the schools. And all across the state, the stories are really similar. We're seeing a lot of youth use and a lot of youth nicotine dependence and a lot of difficulty in quitting. That's really difficult to manage. Like I have another patient who's been hospitalized twice for vaping related breathing issues, and actually has lung damage that you can see on a chest CT, and is not willing to consider quitting because, quote, "I haven't found anything else that gives me the same dopamine rush that vaping does," end quote. One of the difficulties is that there aren't good studies or research to guide doctors in how to help teenagers who have a nicotine dependence. So we do our best to extrapolate what we know from adult data, like using nicotine patches or nicotine gum, but this use is off-label for kids under 18. And so as pediatricians, we try to adapt and support youth where we can. But even if we prescribe these nicotine replacement therapies, there's no guarantee that it's going to work or that people will tolerate the side effects. So using nicotine replacement for youth who are dependent from e-cigarettes on nicotine hasn't been studied. And yet this is what I'm trying to teach other physicians how to do, how to prescribe this, because we don't really have better tools once somebody is dependent. And I wish I had a lot of success stories to share with you, but I don't for youth who successfully quit nicotine. In my experience, this is very few and far between. I have one 17-year-old patient who started vaping in middle school, and he has been able to quit almost completely in the last 6 months by using nicotine replacement patches, but he's still plagued by frequent cravings and says things to me like, quote, "I need nicotine to feel normal. It keeps me going. Without it, I get really depressed," end quote. Teenagers and adults that I talk to in my office tell me about how difficult it is to overcome nicotine addiction. And nicotine withdrawal is very uncomfortable. People get headaches, they don't sleep well, they're really irritable and anxious, they get depressed, and these symptoms make it very hard to stop using it. So it's often a much easier choice for an adolescent to just keep vaping instead of muscling through several months of feeling these really unpleasant symptoms. So you might be thinking, what's the problem? It's just nicotine and it's not like they're smoking cigarettes. But just like Dr. Gogo had described to you before, nicotine has a lot of effects on the body that are separate from what's in combustible tobacco. And it has really unique effects on the adolescent brain, which are very important to consider, that it affects a developing teenage brain really differently than it would for somebody who's in their mid-20s the first time they use a product. Nicotine has this ability to deliver, the vaping process delivers a huge rush of nicotine to the brain, and then it imitates the chemical release of dopamine, just like my patient had noted, which is a reward and a pleasure pathway. It makes people feel good. And so the brain pathways in adolescence that support this quick and easy dopamine release are really strengthened, and then those behaviors get reinforced. They're not finding other ways that get this huge dump of dopamine, and so those pathways get reinforced. The brain gets dependent on nicotine, and then people keep seeking other kind of quick and easy ways to feel this reward and pleasure system. And so you might imagine that this also leads to increased risk for addiction of other forms of nicotine, like smoking cigarettes, as well as other addictive substances or drugs, and there are data to show this. Other longer-term impacts of nicotine on the adolescent brain are things like difficulty paying attention, difficulties with memory, and difficulties with mood disorders and impulse control. And so understanding these patterns is really helpful in understanding why 90% of adults who smoke cigarettes daily started when they were teenagers. So the reason that tobacco-related illness and death is a problem at all for adult Vermonters, and why Dr. Gogo is going to the cath lab, is because tobacco and nicotine addiction is a problem for Vermont's young people. Vermont pediatricians are really alarmed too, because these young people who use e-cigarettes are not necessarily the kids who would otherwise just start smoking cigarettes. Several different research studies show that young people who use e-cigarettes are more likely to go on to smoke combustible cigarettes, probably around the rate of like 4 to 8 times as likely. I think Dr. Gogo showed something that said twice as likely. It depends on the study you look at, but it's definitely an increased risk. And so the prevalence of youth vaping in our state is creating this whole new generation of nicotine-dependent youth that's going to take a lot of undoing. Flavors act as a hook for youth to start using these products, and then the nicotine dependence keeps them coming back for more. So policies like this one before you will help prevent or delay the use of nicotine-containing products for youth, and these should be a priority. So far I've focused on nicotine, but the bill before you is about flavors in tobacco products. Excuse me one second. So we know that the tobacco industry has a long history of using flavored tobacco products to attract youth. They increase the appeal and they improve the flavor and reduce the harshness of the chemicals that are being delivered. So this is really true for menthol, and there's no public health reason to exempt menthol from a ban on flavors, as you heard earlier today from Dr. Valenti. I have in the past talked about other health effects of e-cigarettes on the lungs, and I'm not sure if this committee is interested in me going into that. I know that we're a little bit pressed for time, but there are things aside from nicotine that irritate the airways, and as Dr. Gogo indicated, do have the potential to cause long-term effects, but we just don't have the data on that yet, partly because e-cigarettes haven't been around for more than probably a decade in youth with this type of use. But I have seen a lot of the negative short-term effects like asthma flares, ongoing cough and wheezing, and excuse me, You'll probably remember in the summer of 2019, before the COVID pandemic, a lot of folks needing to be hospitalized for like needing to be on ventilators, essentially for vaping products that probably were tampered with. Someone had asked about if people could figure out how to vape other kind of object or substances like opiates. I think once the technology is out there, like people get pretty creative. I don't know about the actual physics of putting different things in there, but I do think that once the technology is out there, we're going to see a lot of various things. There's already a big industry in the wellness world about vaping vitamins or vaping melatonin, which is probably also not a great way to get those things into your body, but tend not to be very addictive. Anytime there's an addictive substance in it, that's something that really concerns pediatricians. So pediatricians, parents, and schools continue to really struggle to support a lot of these youth with nicotine dependence. And the degree of use that we're seeing is not harmless experimentation, and it's not inevitable either. A lot of youth are showing signs of really serious nicotine addiction. So the school nurses and teachers and young people that I've talked to have told me about students who can't even sit through a 90-minute class without vaping. So this might be something that they're doing surreptitiously in the back of their classroom through their sweatshirt sleeve, like that. Or they ditch class and then they go vape in the bathroom. And that sometimes results of the closure of the bathrooms for all these students. So it affects other students who aren't even using. And students can't learn well when they're distracted by nicotine cravings. And they also can't learn well if they're hiding out in the bathroom during class to satisfy that nicotine craving. So the patterns that are happening in schools are really disruptive to learning. So this is, again, my third visit coming to speak to this committee. I'm happy to take additional questions. The bottom line here is that youth vaping and subsequent nicotine addiction continues to be a really widespread issue in the state. And the flavors really help introduce these products to young people more easily. It helps them establish the brain's dependence on nicotine at a really critical developmental stage. And most of the young people using e-cigarettes are not the same kids who would start smoking if vapes were not available or appealing to them. So I'm here to ask you to please do everything you can to keep tobacco products and e-cigarettes out of the hands of young people. We really have to have policies that make them unappealing and unavailable. And my work in trying to help young people overcome nicotine addiction has been really disheartening. From where I sit in my clinic, trying to support them is downstream of whatever bills are passed or not passed by this legislative body. And I can tell you that where pediatricians stand in clinic, this is the wrong place to intervene. It is a much more impactful place to intervene from where you're sitting, and we really need your help. In order to protect children from initiating tobacco use, the Vermont Medical Society and the state chapter of the American Academy of Pediatrics advocate for complete removal of flavored tobacco products, including mint and menthol, from the market. This legislation can be a key part of that prevention as we work to make these harmful and addictive substances less appealing for youth to use. So thank you for your time, and I'll stop there.
Okay, well, thank you very much, Dr. Ferris. Appreciate that. Well, thank you. Very good. Okay, well, thank you. Very good presentation. And Alex, do you have a written testimony?
I don't believe that I have that.
I might not have sent it over. I will send that to Alex shortly. Okay.
Okay, thank you very much. Appreciate it.
Bye.
Okay, next up, we've got Mr. Manier. And again, if I mispronounce that, please let me know. And I believe you're joined by Ryan Canty. And let me know if that's correct as well.
Yes, sir. So my name is Matthew Minier. I am the SAP at Champlain Valley Union High School in Heinsberg, Vermont. And then with me, I have one of my former students, Ryan Canty. Go ahead, Ryan, you can introduce yourself.
I'm Ryan. I'm a first year at St. Michael's College in Vermont. I'm a health science major. I attended Champlain Valley Union for the last 4 years previously. I was on 3 sports. I played for the football, hockey, and baseball team. I was on athletic leadership council and other clubs like that. I participated in school events and basically the whole community there.
Yeah, so what I have today is a video that we created. So last fall, before Ryan was graduating, what we found was vaping was a real issue in the school. I think sometimes it feels really helpless for both adults and students like Ryan. And so in my position as the SAP, I wanted to try to find a way to affect change. And so what we did is we got Ryan and a couple of his friends and other athletes people who we thought were very important to the school environment and people that other kids really respected. We got together and we kind of had an interview about vaping and some of how kids get introduced to it, you know, the effect that it has on kids while they're here. And so the video that I'm going to share my screen and show is kind of what happened at the end.
Okay, you should be able to screen share.
Okay,
You have control.
I do. I think we are here.
I was introduced to vaping probably in 8th grade.
A kid had brought a vape into school, and the vape, we would say like, oh, you know, it's nothing bad, it's just like water vapor, and kids got hooked on it, and it was people that I knew. Kids were like intrigued in it for sure, and they were like, something I've never tried.
This makes me feel older, right? This is like us entering adulthood when you're 12.
When I got into high school, a lot more people were doing it. A lot of my friends, they pressured people to do it. They asked people if they wanted to do it.
I almost got lucky with being able to say no, because I think some kids weren't able to say no because of that pressure of wanting to fit in and wanting to look cool and act the part.
Vaping led to other things. They started smoking cigarettes. They started smoking weed a lot. They started doing more more harmful things, even though vaping is still extremely harmful.
I didn't really know much about it, but over the years I've learned how awful of a drug it is. There's no benefit to it. It's terrible for you. Huge health risks.
There's nothing worse than seeing somebody, like I've seen kids cough up blood because they like Juul too much.
Yeah.
That's all they've done for the last 4 years, and it's hard because you want to say something to those kids, but you know they won't listen. There's always something you can do.
Not putting yourself in the situations, which is, you know, easier said than done, but just like really thinking out your decisions.
Whether it's related through school, a club, an activity outside of school, just hang out with your friends.
Go places, have fun, play sports, go to the beach.
Doing something other than vaping.
Get away from it all and like just take time off from it if you're using.
I feel like kids are afraid to be like, I have a vaping problem. They're afraid of like possible consequences to saying that. So they just think of it as easier to just keep vaping.
Creating a relationship with at least one adult in the school will help, and I feel like if the teachers are welcoming and you trust them, you know that they're not gonna be mad at you, be disappointed in you, but want to help you. It was hard being alone and not having like friends around you, and you know, I've worked my way through that, but I think everybody can, as long as they have the courage to open up and have a conversation about it with people around you. I feel like that will be a big step forward.
If a friend you know is trying to stop vaping, people are here to help. Go to mylifemyquit.org and follow these steps.
Pick a quit date and try to stick with it.
Tell all your friends and or your family.
Anticipate triggers.
Anticipate withdrawals.
And more in-depth info can be found on these facts at mylifemyquit.org.
Excellent. Thank you, Matt. Thank you, Ryan. Matt or Ryan, do you have additional comments on your experiences with vaping and tobacco?
Yeah, so I mean, I think Dr. Farsi had a really good point at the end of her testimony. I think really what we see here in schools and specifically at CVU is because of the vaping habits that a lot of students have picked up, education becomes really secondary in a lot of situations. In my work, I see a lot of students who have a really difficult time making it through the day without vaping. And what that leads to is them vaping sometimes maybe in the back of a classroom. But I think more times than not, it's trying to find places in the building where they can vape and where they feel they can get away with it. And, Ryan, I want to kind of hand it off to you because in our interview, this wasn't necessarily in the video, but something that we spoke about is the bathrooms are a really huge issue. So at CVU, there has been bathrooms that we've had to close down. And I think he can speak a little bit more to how that feels in the school to a student.
Yeah. So in high school, I would get to school at 8 o'clock and go throughout my day, and sometimes I'd walk in right when school started and I'd see kids handing stuff off to kids and either vaping, and it just made me feel really uncomfortable. I'd walk into a bathroom and I'd see kids blowing smoke in stalls, and what they were doing, and you can't just go in there and be like, hey, stop that. It makes you feel really uncomfortable, and it makes you not want to go into that space. And you could smell it when you went in there. It smelled like I think it's like fruity tooty. Like it smells fruity. It smells like it's a distinct smell that what they're doing and what's going on. It's kind of like weed. It has a smell that stays, and you can smell on kids' breath too. It's not just that. And so I'd walk into spaces, even locker rooms I'd walk into, and kids were doing that. And it just made me, and I know it made other people, feel really uncomfortable as well.
Yeah, and I think ultimately what, from my point of view, that leads to is a kid like Ryan, I think is, really well put together, has, a lot going for him, is somebody who's really confident. But the truth is there's a lot of students that I work with that aren't as confident as Ryan. And so I think what you find is students who maybe don't play 3 sports or aren't as connected to athletics or maybe don't feel as connected to the school are the students who are going to avoid bathrooms altogether or avoid those spaces where that takes place altogether. And I think, just to highlight the point that he's making with the distinct smell, those all happen from the flavors that there are. And I think that's what ends up, like a lot of other people have testified to the committee today, to students who would not necessarily get involved in using any sort of nicotine product to end up addicted to nicotine products. You see that with a lot of athletes.
Yeah, I was introduced in 8th grade. One of my close friends, he handed me something like in the video, and it was blueberry flavored. And I didn't want to take it. I didn't want to do it. I decided not to. It was hard for me because all my other friends were doing it, and it was a really uncomfortable situation. And then once I got into high school, I specifically remember my freshman year, I was driving, our practice field is up on the 2nd level of the high school. I was driving up with one of the seniors, and he offered me a Juul, and the Juul is mango flavored. He's like, oh, take it. It tastes good. And I declined again. And in those situations, I definitely knew that I was putting myself into a predicament here because they could just like end up not talking to me. They wouldn't think I'm cool. In the position I'm in, like the flavors really were appealing to me and appealing to a lot of my friends, because I would see throughout high school, the flavors kept getting more and more different. They kept getting more and more appealing because there was strawberry lemonade, there was mango, there was all these combined flavors, cotton candy. There were all these things that I'd see in bathrooms, and even kids would love mint. I know by my senior year, a couple of my friends were vaping, and they would do menthol and mint. They would do the 2 flavors that you'd think nobody else would be attracted to. But it's from freshman year to senior year, there's such a wide variety of people vaping flavors in high school. And I even saw it in the middle school level too. That's when I was really introduced to it.
So Ryan, we've got a question from Senator Williams. So you're talking about peer pressure. This bill that we're talking about is only to ban certain flavors, the device that they use. Do you think that this bill is going to stop kids from getting the flavors that they want? And
Yes.
what about the consequences in the school? What are we gonna do about the vaping in the bathroom? I mean, that's an enforcement issue. How do you fix it?
I think the first place to start is definitely with the flavors. Kids they're not appealed to something that's not fruity. They're not appealed to different flavors. I feel like a lot of my friends did the flavors that tasted like candy, tasted like fruit, tasted like all these things. They first started and really it lengthened out when they became addicted to it. And I feel like if you start with banning the flavors, if you start with really taking away that aspect of it, kids won't start and there won't be as big of a problem. And especially, I feel like in the bathrooms, you'll see a decline on kids vaping in general. And I bet you there won't be as many, especially in high school.
Do you think this bill goes far enough?
Yeah, I feel like if you ban the flavors, if there is a flavor ban, there will be a decline in kids vaping, and there will be less health problems. There will be less effects on it because kids won't have the appeal to it. I feel like a kid isn't going to have the appeal to a cigarette as much as he is a strawberry mango loon bar, like these disposable things where you can really get it from any kid in school. You can get in the bathroom. And if you don't have that appeal to it, if a kid's selling cigarettes in the bathroom, that's a whole different story. But a fruity.
How about if we banned the Juul devices in the school? How could you enforce that?
I feel like it'd be hard, but I also think the Juul itself is a different problem because I feel like that was started for a different reason, but the flavor itself is what is going to help decline that in the bathroom. I feel like it's mainly you get kids addicted by the flavor, and then there's different consequences from that.
And I think I can speak a little bit to, what as a school and what schools can do to decrease some of the devices, which is, for us, I think what we find is there's a lot of kids that are using. And so I think the points Ryan has made are really good. I mean, I think as a school, we've talked about a lot of different things, which are from putting vape detectors in the bathroom or around the school. Sometimes in certain situations, if we think a student is vaping in the bathroom, we have searches and we try to take those devices away. And I think that's something that we can do. But ultimately, I think our hope is to go step by step. And so, if the first step in the line is by being able to get rid of some of the flavors, I think it helps us helps give us the ability to start somewhere. And I think right now, not having the ability having the ability for kids to go and get flavors at gas stations or from older brothers or from other people that can buy them, I think puts us in a situation where it's kind of flooded the school and flooded the market. And so I think if we get rid of some of that, that's a place to start. And I think if we have less kids who are using, what that allows us to do is to kind of have some more targeted conversations with especially some of the younger kids at this point, where hopefully they won't get started as much. Because I think you heard Ryan say it, a kid who is giving cigarettes away in the bathroom is looked at very differently than a kid who has, a loon or a disposable vape in the bathroom. I think that kid actually would not, I don't think anybody would take it. And yet if they have a flavored vape or a disposable vape, that might end up being one of the more popular kids in the building.
Last question. So were the students that were interviewed help to make that video? Were they actually users or were they just actors?
No, I would say that I did not ask them if they have ever vaped. I would say that I knew that they weren't current users. So, you know, and I don't want to speak for Ryan, but I knew these kids pretty well. I'm a baseball coach and some of the other stuff that I do. And so these were all baseball players and involved with baseball at a pretty high level. So I was pretty sure that they were not using. However, I think like Ryan gave voice to, they had all been in situations where I'm sure they were handed a vape and asked to use. And so had those students ever tried vaping? I don't know, but I think like many of the other students that I work with, I think it's safe to say a lot of them at least have tried it maybe once and then maybe found it wasn't for them, or they made the decision that Ryan did and didn't try it. But it's not an explicit discussion that I had with them. But I do have explicit discussions with a lot of students at school who are current users of vaping. And I think their story really lines up to what Ryan's is. And I think the reason why I highlighted a couple minutes ago about somebody not having as much confidence as Ryan did, or Ollie or Jack, is that those students are really looking for a connection and maybe aren't as active in athletics. And so for them, their connection point is to take that vape and to try it. And then once they try it, that's where that connection continues to come from. And so what it ends up doing is putting the school in a position where, again, education is secondary and, you know, the connection point is primary, which we know for students, but they're connecting around using these, you know, these flavored vapes or just vapes in general. And I think that really changes the environment of the school. And I heard Dr. Farsi say it's really disheartening, you know, from a pediatric medicine standpoint. And I think at times it's really disheartening in the schools too, because there are a lot of kids vaping and a lot of kids using. And I think sometimes it feels helpless. And I think the project that you saw came out of us wanting to try to do something. And I think if connection point is what is bringing kids into this, along with the flavor aspect of things, I think telling them that it's cool and showing them that actually it's cool to say no is another way that we can try to affect change. And so I think that's what we were trying to do.
Great presentation. They're lucky to have you for a mentor and a coach.
Thank you very much, and we appreciate your time.
Thank you.
Senator. Okay, so I do have a question for you. So we're dealing with a question of making something illegal, but it's pretty clear right now that for those 21 or under 21, that tobacco, alcohol, cannabis, it's all illegal. What do you think the net effect of having another law will be on the students using flavored tobaccos? I mean, what's your sense of impact, considering so many other illegal substances are already banned, but they're still being, you know, pretty heavily abused?
Yeah. So, I mean, I think my sense is that hopefully the idea is we're able to support them. And I think we're all there in the school, and people in the mental health field are there to try to support them. But I think some of what we're hoping for by having the ban is that we prevent some more kids from getting into it. And so to me, I think when the ban comes into effect, or if the ban comes into effect, our hope is to be able to then have the kids that are using pretty heavily and help them find ways to stop if that's what they want to do. And I think eventually a lot of kids will tell me that they want to stop. I think they need help. What that means is connecting them with doctors or people that may be able to support them because of the habit that they've created, but also sometimes it's that their parents don't know. So it's starting to have conversations, open conversations with them and their parents and doctors who can hopefully help them, you know, make some decisions and make some choices that allow for them to stop. But I think one example that I would give is, yes, alcohol is banned for students who are under 21, obviously. Does that mean students completely don't drink? No, but I would say we don't have students drinking alcohol in our bathrooms at CVU. And the reason why we don't have students drinking alcohol in our bathrooms at CVU is because it's very hard for them to get their hands on, or harder to get their hands on than vapes and even flavored nicotine. And so I think ultimately what that does is bring some of the numbers down, and it's a little bit easier to be able to police or to help support students when there's less students that are using, I would say.
Okay, thank you. Any further questions? Sure. Okay, well, thank you, Matt. Thank you, Ryan. Appreciate your time. Very compelling, and the video is excellent. It's excellent production. And do we have the video?
We do. It's saved
We're going to
on
post it. Okay, very good. Thank you both. We're going to move to Mr. Artu, and again, if I mispronounce your name, please let me know. But Mr. Artu, you have the floor.
Awesome. Thank you so much. Good afternoon. My name is Artu Wichi, like Quichi with a W. My pronouns are he, him, his. And before I give my testimony, I just want to give a special thank you to Dr. Farsi for validating some of my own health issues, being a former smoker, like attention span memory issues, especially the withdrawal symptoms. I'm like some of that I didn't actually know. So thank you. So I'm a Vermonter. I'm BIPOC. I'm queer. These social identities, you know, I'm kind of in the category of those who are most likely to smoke. Unfortunately, I'm not only a former teen smoker, but I also actually recently relapsed on flavored tobacco. And I'm here to speak a little bit on my own personal relationship with flavored tobacco and why I believe this ban on the sale of flavored tobacco is going to be important as a public health policy. And I can tell you right now, I can personally testify, natural tobacco flavor actually doesn't taste that great, but artificial flavors do. And you know, growing up, I lived in a mainly BIPOC neighborhood, and with the statistics that 85% of Black smokers smoke menthol and 50% of Latinx smokers smoke menthol. When I was given the first cigarette to try at 16, it was menthol, and I pretty much got hooked on it right away. And now that I've relapsed, I still don't really like tobacco flavor, so I'm opting for the artificial flavors. But if I were to only have the natural tobacco flavor, it would be a lot easier for me to sort of bring it down and actually quit, rather than something that's smooth and tastes good, like menthol or mint. And I feel that this legislation is really in line with what's happening around the United States. The FBI has come out with policy guidance in the same thing of banning flavored tobacco. It's also, this kind of laws already passed in New York, California, and Massachusetts. And in fact, the Supreme Court of the United States has set precedent that the public health interest in California's policy is constitutional and overrules the right for tobacco companies like Reynolds British Tobacco Company and other similar plaintiffs to sell unnaturally flavored tobacco. Please know, I hear your concern about what happens when you make something illegal. I personally am a big believer in decriminalization and the use of public health intervention as an approach rather than criminalization. I submitted a written testimony for S19, basically saying the same thing and suggesting that prevention, cessation, and management programs is actually used in the addressing of this issue rather than criminalizing it. And this kind of approach is supported by both the World Health Organization and a bunch of international studies. And I know that this bill has come up year after year, and I am really, really hoping that this year is finally the year where we can loosen, you know, the flavored tobacco's grip in our lives. And I really hope that the money given through this policy goes towards more reparative process, like I said, towards prevention, cessation, and management, and public health approaches such as that, rather than criminalization. Thank you.
Okay, very good. Senator Goulart.
Just quickly, I just wanted to say thank you, Richie, for your testimony, and I'm sorry that you had a relapse, and I wish you the best in your cessation journey.
Okay, well, thank you very much, Mr. Artu. Appreciate your testimony. Unless there's any further comments, I'm going to wrap for this morning, go off air.
Can I make one additional comment? in response to your question about does this bill go far enough to do the to keep things out of schools, I think one thing that's really important about this is that it is a comprehensive flavor restriction. So what happened when the FDA said no more flavors in Juul-like systems, we saw a shift in what youth were using to go through disposables, which is, so now it was pretty quick that they went to Puff Bar, Loon. There was a loophole. So people were able to get around that in that way. Same thing with shifting to mint or menthol. And so when those are off the table, and then just as Richie was describing, the tobacco flavor is what's left, then that's not as much of a hook for people. The fact that it's a comprehensive ban is about decreasing the appeal and then the access issue, which I think if it's not available for people to get from their older brother buying it from the corner store and getting into schools, it's part of a bigger approach, as Mr. Munier was saying. But it is, it's important that it's a comprehensive ban, and it does decrease the appeal a lot for youth to start.
Excellent. I appreciate that. Thank you, Dr. Pearson.
Thank you.